Good morning, Chairwoman Pinto. My name is Zach Ragone, and I'm the Policy Director for the National Reentry Network for Returning Citizens. Our work is grounded in a simple premise. Public safety is the downstream result of public health, shaped by the quality, stability, and dignity of the environments people move through. When public health breaks down inside a jail, the consequences show up in the community soon after. That's why conditions of confinement are not a side issue. They are central to the reentry outcomes and public safety across the city. What we are seeing at the D.C. jail reflects long-standing unresolved failures. Independent audits and inspections have repeatedly documented unsafe conditions, failing infrastructure, extreme temperatures, malfunctioning doors, and inadequate ventilation. Despite years of warnings, conditions have worsened, not improved. Most troubling are the outcomes. Deaths in custody remain well above national averages, especially from overdoses. These are not unforeseen tragedies. They are the predictable result of known risks that have gone unaddressed. People held in environments that degrade physical and mental health do not leave custody better prepared to stabilize their lives. They leave carrying trauma and untreated illness with less capacity to succeed. And the district absorbs those costs when they return home. These same conditions also affect the people working inside the jail. Chronic understaffing and unsafe facilities have created an unworkable cycle. Burnout leads to vacancies. Vacancies lead to overtime, and overtime increases risk for everyone. Improving conditions for residents improves safety and stability for staff. Relying on crisis response does not. Oversight gaps are especially clear in healthcare and visitation. Serious medical and mental health needs remain unmet, and we still lack clear answers about treatment capacity or why deaths are occurring. Visitation is frequently restricted, often justified by contraband concerns. But available evidence shows contraband more often enters facilities through staff misconduct and mail, not family visits. Limiting family contact weakens mental health and reentry outcomes without addressing real sources of risk. All of these issues point to a deeper harm, dehumanization. When people are confined in environments marked by neglect and constant crisis, the message conveyed is not accountability, it's disposability. That corrodes rehabilitation, staff morale, and public safety alike. Incremental fixes are no longer enough. The district does not need to stabilize conditions immediately, but it must also move towards replacing an outdated facility with one designed for health, dignity, and rehabilitation. A new jail must be better, not just newer, designed around medical and mental health care, natural light, fresh air, robust programming, and nutrition that supports health. And it must include a formal, legally mandated mechanism for community oversight and transparency so these failures are not repeated. If we want safer communities, we must stop ignoring the conditions people are coming home from. Thank you for the opportunity to testify, and I'm happy to answer any questions you may have.